Good afternoon. I'm Joria, and I'll be your nurse for this afternoon. Can you please state your name and date of birth for me? Okay. I'm going to confirm this with the physician's orders. All right, Mrs. Smith, it looks like we're going to be doing a urinary catheter insertion today. With that procedure, we're going to lubricate a tube and insert it into the urinary meatus, which is going to be connected to a urine specimen bag. And it helps with any discomfort or urinary retention that you may have. So we're going to start the procedure. I'm going to lift your bed up. Do you have any allergies to latex, betadine, or iodine? Okay, none. I'm going to start the procedure with perineal care. So I'm going to apply gloves. Okay, Mrs. Smith, I'm going to have to lift your covers back and your gown for the procedure. I'm going to clean each area with a different corner of the towel. I'm going to discard this in the proper linen cart. Okay, Mrs. Smith, we are going to begin the procedure. I'm going to come over here to create a sterile field for my sterile gloving. Okay, for this procedure, a male would normally be in a supine position with their thighs slightly apart, and a female will be in a dorsal recumbent position. But for the sake of this video, we're going to keep our patient in the supine position with their thighs slightly apart. I'm going to discard this. I'm going to lay this on the waterproof side down in order to extend the sterile field. I'm going to squirt some betadine iodine solution in this reservoir and discard it. I'm going to remove the tube, apply some lubricant, and discard that. And then I'm going to remove my specimen cup. Get the tubing. Remove the cap of the syringe, and I'm going to inflate some water. I'm going to insert some water to inflate the balloon just to make sure that it is working properly, and it is. I'm going to draw back that water, and I'm going to leave the syringe in. I'm going to leave the tube laying in the lubricant so that it can lubricate the tube 2 to 3 inches, and then I'm going to start with perineal care. Clean this side and discard. Clean down the middle and discard. Okay. Now I'm going to insert the tube 3 to 4 inches with the syringe still attached. I'm going to insert it 3 to 4 inches inside of the urinary meatus. You will feel some discomfort during this process, but that is normal. Urine return is noted. I'm going to keep my hands securely there, and I am going to inflate the balloon with 10 cc's of water. Once that is done, I will remove the syringe and discard of it, and I will securely tape the tubing to the inner thigh of the patient. For a male, it's supposed to be taped to the abdomen, and then I'm going to hang the collection bag on the patient's bed frame, and I'm going to clean the perineal area to remove all of the excess betadine and iodine. Then I'm going to clean my area. I'm going to assess the patient to see if they are in any pain, major pain or discomfort. The patient is fine. I'm going to lower the bed and make sure that the side rails, both side rails, are up. If a urine specimen needed to be collected, at this time I could have collected it because the urinary catheter was just inserted, but after 5 minutes that urinary specimen collection bag is no longer in use. I would have to collect the specimen from the urinary port. Good morning. I am Jory and I'll be your nurse for this morning. Can you please state your name and your date of birth for me? Okay, I'm going to confirm that with the physician's orders. Okay, Mrs. Smith, we are going to remove the urinary catheter today. I'm going to elevate your bed. And again, with this procedure, I will need to move the covers and your gown up. I would empty the specimen from the bag, from the collection bag, making sure that it is still below the patient's bladder. Once I am done removing the specimen, then I can bring it up here and begin the rest of the process. I would untape it from the patient's thigh. Insert the syringe. And I will make sure that I draw out the full 10 cc's of water that was inserted into the patient's inflation balloon, making sure that the entire 10 cc's is out. Once that is done, can you please hold your breath? I'm gonna take a deep breath for me. Okay. Now I would discard of this. Okay, Mrs. Smith, we are done. I'm going to cover my patient up, making sure that their privacy is still maintained. I'm going to lower the patient's bed, making sure that the side rails are still up, and make sure my patient is in a comfortable position. And then I will document the procedure on DocuCare. Thank you.